Barb Schwartzberg. I'm a breast surgeon in Denver, Colorado. Novilase interstitial laser therapy procedure is very concise, and that's one of the things that patients really like. It's done in an outpatient setting, usually under ultrasound. The patient is awake, although I like to give them a little bit of sedation with Valium, local anesthesia, very friendly crew. Once the laser probe is in place, using usually ultrasound guidance, the actual treatment takes between 8 minutes to 25 minutes max. And then the probes are removed, a Band-Aid and dressing is applied, and then they go home.
My name is Robert Maganini. I am a breast surgeon working at the Alexian Brothers Health System in Chicago, the suburbs of Chicago, Illinois. For a woman who enters this trial, in order to qualify to be in the trial, we must first do, in addition to her standard evaluation, which has come about through the diagnosis of her cancer, we need to do a breast MRI. That MRI is reviewed, make sure that she meets the criteria for entry into the trial, and then the laser ablation procedure is done. 1 month subsequent to the actual ablation procedure, there's an additional set of imaging, including an MRI, a mammogram, and an ultrasound, just prior to the surgery itself.
My name is Eric Whitacre. I'm a full-time breast surgeon in Tucson, Arizona. At the present time, one of the big benefits to patients undergoing laser ablation is that they're participating in a clinical trial. This is moving the ball down the field. This is important for science. Other advantages include more intense surveillance, so double reading of all their imaging studies and their pathology.
My name is Dr. Hanadi, and I'm a breast surgical oncologist with the Wheaton Franciscan Medical Group, and I chair the breast program leadership. My practice is out of Milwaukee, Wisconsin. We're here today because of clinical trials. We've gone strides from the scorched earth mentality of radical mastectomies to now everything is tailored specifically to that patient.
My experience with treating patients with laser ablation involves treating both benign and malignant tumors of the breast, and compares very favorably with surgical treatment. I've done a series of patients with fibroadenomas and uniformly experienced good results and resolution of the fibroadenomas with excellent patient comfort and patient satisfaction. In our new experience with the malignant tumors, these procedures also have gone very smoothly with excellent patient acceptance, patient satisfaction, patient comfort.
The difference between performing a laser ablation and surgery is a little bit night and day. One is performed in the office with the patient awake under local anesthesia. Surgery is an operating room procedure where the patient is either heavily sedated or many times is asleep under general anesthesia.
One thing I've come to realize with the laser procedure is cosmetically how good the patients look after the procedure. Anyone who's thought about a lumpectomy or looked at a lumpectomy done traditionally with surgical excision in the past usually sees or feels a large divot where the lumpectomy was performed. With the laser therapy, there's no volume loss. I mean, the contour stays the same, there's no bruising or bleeding, and there's very minimal scarring because we just had these 2 pinpricks that are used to insert the equipment. So a breast really looks normal immediately after the procedure. And that's very different from traditional lumpectomy procedures.
If not for innovation and the push and the willingness of physicians to participate, we won't be in a better place tomorrow.
There are several excellent resources for women to find out about this trial. My favorite is the actual Novilase website itself. It has a great number of different resources, videos, and links. There's information related to the Novilase trial on Facebook and Twitter, which is also valuable information about the trial as well.